welcome. Is everybody on? Make sure everybody's on. All right, we'll call the meeting to order. It is 5 o'clock or 1 minute till. We're going to start with the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, Miss Rhonda, give us a roll call.
Mr. McKenna,
Present.
Dr. Caddick,
Present.
Dr. Lim, Dr. Turner,
Present.
Dr. Ross, Jeff DePass,
Present.
Mark Kyleman, did I say that right?
Present.
Dr. Brucken,
Mic check. Present.
Joni Wise.
Here.
All right. First of all, we have the minutes from the last meeting from April 19th. That will need to be approved, so I will entertain a motion.
So moved.
Second.
All right. We have a motion and a second. All in favor, say aye.
Aye.
Opposed by the same? All right, motion passed. On to the financial report with Rhonda.
Any questions? No? No? We're zooming right along with it, so.
All right. No questions for the financial report. We'll move on. Next up to Dr. Brucken.
Thanks, guys. I don't have a whole lot today, which is good. Business as usual kind of stuff, so I won't belabor things with just small checks. So back to you.
All right. Excellent. And now on to Joni.
All right. We've completed our building safety plan, and it was approved by the commissioners a week ago Tuesday. And so now we're going to develop a training and exercise program for natural and man-made disasters for our employees here at the annex. Help them purchase some materials to go into to-go kits for each of the zones that the building has been broken into. We've got zone captains and backup co-captains. So again, that passed a week ago Tuesday. Worked on budget development for next year, something that we're going to talk about a little bit later on. Still working with the Ray Park building restoration. Working with the county parks, we were able to use some of our funds that we were reimbursed for giving COVID vaccines to help complete the Wabashiki Trail. So that will be something that people can use for quality of life and for lifelong physical activity, the walking. Worked with the Human Resource Department on the Baker-Tilly compensation plan. It looks like there's going to be some action taken on that for all county employees in August with some retroactive pay for those that have been identified as being below midpoint. And retroactive back to June the 1st. So we're pretty excited about that and hoping it does come to fruition. But met with the people from Baker-Tilly to make sure everything was good, and all of it came out to be just the same as what we had been kind of fighting for since about 2015. It was the exact same corrections that are finally now been corrected for our department. So I'm pretty happy about that, but just keeping busy with our day-to-day operations. Going to meet on Friday with some individuals over the Governor's Public Health Commission funding, but I'll talk about that a little bit later on. But yeah, just doing my thing.
That compensation report from Baker-Tilly, does that cover all county employees?
It does.
Okay.
It covers all of them. And it was a very extensive study, and it showed who was below, who, what our salaries would be if we were brought up to the minimum, the 25 percentile, and then the mid-range and the maximum range. As we have been told, we'll move up to the 25 percentile in August, retroactive to June the 1st, and then July 1, all employees will move up to the midpoint range.
Oh, wow.
So it will finally put us in a place where we'll be competitive with the regular market.
Yep.
And try to be able to pay employees, especially professional employees, because those are the most difficult to bring in and retain.
Absolutely.
But I also wanted to take a moment to introduce somebody to you. If you aren't aware, the state has moved towards a district concept to be able to help local health departments. And the individual that's going to be the administrator for District 5, 6, and 7 is here, and I'd like to introduce him. So Mike, if you want to, come on up, Mike Sutton. Yes, please.
Yep, all right.
Yeah, thanks for having me out. So Mike Sutton with the Indiana Department of Health. I'm going to be the Central Region Administrator. Started at the end of June, and we've kind of hit the ground running, planning one-on-one meetings with each county right now, and Joni and I are meeting tomorrow morning, so I was able to get here a little early tonight and join you on this meeting here. So yeah, really just going to be a resource for the region, for all 3 districts. I'm going to have a team with me too that's going to have specialists on the health services side. We're going to have a data analyst that you'll have access to, a finance analyst that you'll have access to. So just a team approach here to help all 29 counties in the central region. And then also trying to help navigate counties working with each other a little bit more too, to be more efficient in our resources. So that's what I'm here to do. Thanks for introducing me.
Did you say 5, 6, and 7?
Yeah. Yeah.
Where does that cover, Mike? 5, 6, and 7? Just ballpark.
Basically, all the way across the middle of the state.
Okay.
So from border to border,
Okay.
basically. Yeah.
Great,
Yeah.
thanks. All right, on to new business. Proposed 2024 budgets?
Yes.
Joni?
There weren't any changes from last year. If you remember, last year was the first time ever that our budgets were passed without any cuts. So I'm hoping for the same thing this year. I feel optimistic, but no big changes. The only thing that the auditor's office is working on is, State Board of Accounts sets up the schedule for how all municipalities are to do their budgets in the state of Indiana, the timeline. And we followed the timeline as the auditor and the council gave out guidance. Well, then guidance came out from the state to all auditors' offices the first week of July saying that the local health maintenance and the trust fund will cease to exist, and they will now be under a different fund. So if our commissioners go with the Public Health Commission funding, it will go in that fund. Or if our commissioners stay with the legacy amount, which is what we're going to call the trust and the local health maintenance, that will go into that account. But as far as those 2 separate accounts, they will no longer exist. So what we have to look at is and then the auditor's office went off to their state conference last week, so we'll just look for guidance on how they want us to define or how to move forward with our budget. But right now, we're keeping it as it is.
So there's 3 aspects to this, correct?
Yes.
And so it's an action item. Do we do each one of them, or? do you wanna
Generally,
do
they're
the-
all done together, but if you want to separate them out, that's
Okay.
fine too.
Okay. All right. Has everybody reviewed those? I think we received them in email. All right, cool. I'll entertain a motion to approve the 2024 budget items as proposed.
So moved.
Second?
All in favor, say aye.
Aye.
Opposed by the same. Thank you. That's motion passed. On to intern reports with Jess Rankin and Andrew Martin.
Jess, you want to introduce yourself? Because
Yes.
Andrew's already did introduce himself, I think, twice.
So my name's Jess. I'm interning with the health department. I just graduated at ISU, and I'm actually attending grad school at ISU as well with a public health degree. And I will also be doing the graduate assistant, so I'll be teaching a basic public health class. So that'll be interesting. But I started interning, I think, here at the end of May, and I've been interning since. I've done a project, and I did it with the juvenile center, and I did a little presentation on vaping and smoking. I thought it went well. The kids were very interactive. I did a little questionnaire with them, and there was 13 kids, I believe, and 10 of them said they either smoked or vaped. 2 of them have never smoked, and then 1 of them had smoked, but they stopped. One thing I wish I would have done is I wish I would have asked if they smoked or vaped, because the ones that said yes, I don't know if they vape or smoke. I'm assuming they vape. It's more common in kids, but I wish I would have asked if they would have been more specific. But being at the health department, I've seen and learned a lot of things. I've learned every day is different. There was one day we were going out and picking up tires, and we saw a naked lady sunbathing. I mean, you just see anything, you see everything. So it's definitely been very fun interning here. Everyone I work with is very friendly and nice, so I'm just excited to continue interning. So that's all I got. If you guys have any questions.
Where are you from?
I'm from Greenfield, Indiana, so it's
Okay.
like, 30 minutes east of Indy. So, but I've been here since 2019, and because I'm doing grad school, I'm going to be living here for at least 2 more years. So,
Okay.
yep.
When the naked people incident happens or things like that, they come back in from the field and we'll go, "Welcome to public
Yeah,
health."
for sure. It's definitely something. But yeah, that's all I got.
Thank you.
Thank you.
I'll be quick with mine. So last time we met, I was doing my program, and so it was a 4-part series of stress reduction. And so we did a general stress information. That was the first session. Second session was a chair yoga session, which was surprisingly super beneficial, in my eyes at least. The third session was a nutrition segment, and for the most part, the people who attended thought it was very informational. And then the last one was a 3.4-mile walk along the Wabashiki Trail from the commissioner's office. So we did a little 5K. And I'll just give you an overview of what all I've been doing since then. We began tire amnesty, and so me and Jess and Lily from IU, we went around picking up tires. Like Jess was saying, we saw a naked woman, and it was pretty traumatizing, to say the least. Then we did catch basins to help stunt mosquito growth. That was pretty cool to learn how to do and, understand how all that works. And then I've went on various inspections from houses, restaurants, and started doing some septic inspections, which is pretty interesting to say the least. And then I've even done some inspections on my own with Jess and Lily as well, which is super fun to do. I like those. And then recently, we just filed away and reorganized all the septic permits, and that was a big task, but we finished it today, and it was really exciting. So,
Awesome.
yep,
Awesome. Thank you.
that's it.
That was like 14,000 permits that they put in separate files,
14,000 pieces of paper?
pretty much.
And Andrew was gone on vacation, and everybody pitched in and they helped out. They helped Jess do some. And so when Andrew got back, he was led to believe that Jess did all of those herself.
Nice.
So he was moping around all quiet until we had to tell him it was just a joke that everybody helped.
All right, thanks to our interns.
Yeah.
I appreciate you guys. Down to old business. And Joni with the Governor's Public Health Commission funding.
All right, this Friday, Jimmy McCanna, Jim Bramble, the auditor, 2 of the Vigo County Commissioners, Todd Thacker, that's the council president, and Mandy Bells and myself are going to meet, and we're going to go over the workbook for the Governor's Public Health Commission funding, looking at all of the positives about opting in, what might be a caveat for us to opt out. Do we want to opt out for a year and see how it goes and then opt back in? But it's looking at what's going to work best for our county. One of the things I handed out was, the core public health services that they want us to do, that we have to do. And I've squinted really hard, but we do everything on there and do it threefold. And so one of the things we asked the staff to do is say, is there anything that we could supplement, or, we don't want to waste somebody's money. And then it's looking at, we have had a lot of agencies reach out and say, well, where's our money? We were told that we were going to get your money, part of that money. So that's been kind of disheartening because we're really not equipped at this point to be a grant funding agency. So I think it's just looking at all those positives or caveats on how do we move forward.
So Joni and our gentleman guest, have they determined whether the funding will come to the counties or to the district?
Counties.
So there was some concern about that at one time, right?
There's
Maybe
the,
more district managed, but it's not going to be that way.
yeah, the language involved
Everybody will
in
get their own, all
Senate Bill 4.
102 counties will get their piece of.
But then it's looking at, there was a good article on Politico maybe Monday, and it was about how public health funding increased in Indiana by 1,500%. Then you get to the very bottom, and they have somebody who ran Holcomb's, political campaign citing, this is fantastic for Indiana, but if the counties aren't able to, do what they're asked to do, we don't know what's going to happen after the 2-year funding period. And then when you look at the book that I handed you from the Fairbanks School of Public Health on what our workforce looks like, it's kind of difficult to think about how some of these little counties are going to do this and not have the employees, because we struggle as a county our size to to get employees. So, you say to Vermillion, for example, where, they have to have a licensed lead risk assessor, they have to, and you go through all that stuff. And it's just like, okay, yes, these are wonderful things, and that's why we already do them, but where are you going to get the people to do them?
So under this program, are we supposed to be the ones coordinating on this? 'Cause some of these services, the Lugar Center does some of them.
That's
There are
right.
other agencies in our
Correct,
county
and
that
that's
are
what,
handling it.
right, and I think it's looking at, are these things being done in our county? So you look at
Okay.
like infant mortality.
Right.
Union has their Healthy Beginnings grant.
Mm-hmm.
They do, and then they're the ones that also facilitate the FEMR and all those different things. But there's so many other mechanisms that are in place that we don't want to duplicate services.
Right.
We just want to enhance and continue to participate, because we've been on the CAN and the FEMR and all those, the tobacco and prevention cessation committees. I mean, everything that is asked on here, we do. The only roadblock we hit was with the school corporation. They don't want a school liaison person from the health department, only because they already contract with Union Hospital for health liaisons. And so they said it would not benefit us, but there's a waiver that we can submit to the state to say this is something that we're not going to be able to do. We already collaborate with the school corporation on immunizations, screenings, anything, and on the clinical side. But as far as health programming, they have a really comprehensive curriculum at the school corporation. And when we did our feedback as county employees on the original blueprints of this, that was the only thing that I thought stood out that we were kind of getting out of our lane. And that was as a school board member.
Well, to me, finally, getting our salaries where they should have been
Yes.
10 years ago, hopefully will help with recruitment. And then liaisoning with like ISU for their master's program.
Yes.
And I don't know if Ivy Tech has any type of programs that kind of lead in a public health venue, an associate level.
I think just clinic nursing. That's the only way I'm aware of at this time.
Okay. Because they're getting some extra money too, even from Union Hospital,
Yes.
right? $1 million for health education. Geared towards nursing, I think, but
Sure.
maybe all of it.
So I think what I heard you say is we basically have the infrastructure, we're doing a lot of this anyway, so is there any reason not to pursue this if we already have? I mean, this would just enhance, the funding would enhance what we currently do, is that what I heard?
So maybe Mike could answer this. Would it supplant what the county already provides off, yes, please, off of our levy? Because that's one of the questions, we've got the little workbook printed out for everybody for Friday. But that's the concern, that if you supplant it and you say, okay, well, we used to get the, 1.234 million from a levy, and we now supplant it with the funding from the Governor's Public Health Commission. What happens in 2 years if they say, no, we're not going to do this legislature, we're not doing it again?
But I guess my point is if we already have the resources in place to administer some of these programs, if not, or the ones you have checked anyway.
All of them.
So then, I guess help me understand, why would we not opt in?
I don't know that I can answer a question whether you should opt in or not opt in.
Sure.
But just to talk about the funding a little bit. So you've had the legacy funding, the health maintenance fund, and the trust. This, it's now being called Health First Indiana funding, or the governor's public health. The Health First Indiana funding would replace that, okay? And so there's a allotted minimum and maximum amount of funding that would come in 2024, and then that changes and increases in 2025. But there is a county match with that, which is what that 1159 or tax levy
Yes,
funding
it's
would be.
So is that the 20% I read about?
Yeah, so the hope is, because we're significantly underfunded if we look nationally, right? There's a certain per capita public health spending per person there that we're significantly under all across the state. And so the hope is to get us closer to that. So the hope is that the tax levy remains the same, and the increased funding from the Health First Indiana funds can get us closer. It's still not going to get us up to that national average. Legislature didn't approve that much funding, but it is going to get us closer to that number. So the hope is the county funding, that 1159 or levy, the tax levy funding would remain similar, and then you would get the increased Health First Indiana funding in 2024 that then even increases more in 2025. So it is to enhance the programs that you already have. And what we generally lean people to is look at the statistics, see where you're at on life expectancy, how you're dealing with chronic disease, what are causing your health issues, and can we direct the funding to those locations? So it's really taking a look at the data to figure out where that is, and that's what we'll chat about tomorrow, is what are
Yes.
you looking at to, if you do take the money, what are you looking to do? So.
Yep, but the biggest concern is will that levy remain the same? Do you keep maintaining it in case in 2 years they say, no, the next biennial budget, we're not doing it, or we'll cut it substantially, and then we don't have the money from the levy to go back to. That's the only thing that's the gray area.
And the only response that we've sort of been given towards that is the spirit in which the legislature passed that funding. It's every 2 years, no matter what. I mean, that's how we function in the state, is the budget's every 2 years. But the spirit of that was an understanding that it would be a sort of ongoing funding that would happen. And the legislature decreased it, knowing that, hey, if we commit to this, we need to be able to commit to it further than 2 years. So just to add to that, I
Sure.
guess.
Oh, that's good.
I'm pretty sure it had bipartisan buy-in also from
It
the state
did.
level, so that,
It did.
It did.
looking at sustainability, as whichever way the political waves flow, it seems like it would be sustainable.
Yeah.
Of course, we're going to have a new governor, and we've lost our health commissioner. Well, a good replacement. We work with Dr. Bach, so that level's changed a little bit too.
Yeah.
They have a strong commitment to see this go through, and they'll be gone.
I would say Dr. Weaver, I can't speak on behalf of Dr. Weaver, but I don't know if she's reached out yet, but she will want to come visit the county pretty soon, and the health board fairly soon. She's trying to get around to all the counties relatively quickly. And this is one of the big topics of conversation, obviously.
And when we are done meeting it's a conversation on Friday, and then we'll meet again, but I will send a recap out to all of you on what happened at that meeting and what we're going to do next, and when we're going to do it.
And it's got to be voted upon by September 1st.
We have to just submit our commitment to do it by September 1st.
Okay.
And that would come from the county commissioners.
Okay, perfect.
Let me add to that. So opting in, yes, before then, but your actual budget has to be submitted by September 1 as well. So just to make sure that that's clear. And it's not a super complicated process, the budget they've made.
It's the same template that we've
Yeah.
used for years
Yeah.
for our trust fund and local health maintenance.
Okay.
Very
Yeah.
familiar with it.
Yeah. So.
Thanks, Mike.
Yep, thank you. Anything else?
Credit card update.
Credit card update.
We're almost there, you guys. Okay, so in January, we reported out, we were working with a company called Heartland. Then the auditor's office, no. Then the treasurer's office told us that that's who we used to use, but now we're moving to another platform. So for continuity purposes, we went piggybacked off their contract. The problem was that no matter what we did, that they couldn't separate our information from the treasurer's. And so the treasurer's office could look at, who got a birth certificate or who got a vaccine or any of that kind of stuff. Every time they would correspond with us, they would correspond back to the treasurer's information and not ours. They could not, everything was so commingled and they couldn't fix it. And so we went back to Heartland. We did a trial run with the little credit card readers today. Rhonda, is there anything you want to add?
We have the environmental health one. It's up and ready to run. Admin, sorry. The vitals may take a bit. They're discussing that in IT because it has to have an internet connection. So they're working on that. And then we were too short because we want to have one extra terminal. So then they are mailing the 2 here. And then once those get going, then it'll go into the clinic and we'll be ready to go. So, been talking with the treasurers on how we do quietus and turn in our receipts. And I think we got our ducks in a row.
All right. Sounds good. Thanks for the update. Okay, on to the program updates with Mr. Graylis, Vector Control.
Hello. Well, we started out when we distributed approximately 5,500 Skeeter Beater coloring books to the Vigo County elementary schools before they closed for the summer. Little kids like those. We started our light trap program, and we've started our larviciding program and our adulticiding program. As Andrew touched on, we, with the help of the interns and the environmental staff, I gotta say, because the environmental staff helped this year as well on tar amnesty program and catch basins. We were able to knock the catch basins out and still working on our tar amnesty program. We're still accepting tars and we still are picking tars up out of the alleys. We've filled about 4.5 semi-trailers so far. Mosquito season's going pretty normal. I would say normal. The state of Indiana's had 5 positive pools for West Nile virus, which is kind of low. Surprising really, because I know locally here, everything that we're sending in, we're about 85% are Culex pipiens and Culex restruans. So I thought we would have a West Nile positive by now, but we haven't. But the state of Indiana has tested 421 pools of mosquitoes. Like I said, 5 of them have tested positive from 5 different counties. That's it. Triple E's so far, none. So, I mean, everything's kind of a strange year. But I want to emphasize, without the help that we got this year from the environmental staff and Andrew and Jess and Katie, we would have been struggling a lot because they really worked hard. And, you know, until you went out there in the hot sun and threw them tars around with mud and God knows what else in there and seen naked women, you don't know really, you can't really appreciate all the hard work they've done. But I do. I want you all to know that. I do. Yeah. That's all I've got, unless you guys have any questions.
Hey, Mike, did you, there's obviously been a handful of cases now of domestic malaria down in Florida and Texas. You talk about that breed of mosquitoes. Do you know anything about, I mean, they're not here, so.
No, Dr. Turner and I talked a little bit about that on the way coming in, because Dr. Turner kept me informed about that actually. It's a little scary, like I told him, you know, because when you think about how West Nile developed and spread across the country, and malaria has been eradicated for years in the United States, and then now you're seeing it in Florida, the possibility is always there. And when you do my line of work, you don't need anything else. I mean,
Yeah, I think it was the first malaria cases in 20 years that was not imported. People acquired that malaria here.
yeah, so I mean, it's a little scary. But like I said, so far everything we've been getting is QLEX, and that's because we just haven't had enough rain. I know every year I get up here and I tell you guys that we need more rain, but it's not washing everything out, and the water's stagnant. QLEX numbers are high, and I don't know if you set out on your porch late at night or not, or around 8 o'clock, you're going to get bit. I mean, the mosquitoes are out, but we're doing everything we can, and that's all we can do. Keep our fingers crossed and hope that nothing develops here, But yeah, the malaria is kind of interesting. But yeah, Dr. Turner, my friend, always keeps me informed on that kind of stuff.
Well, it's a terrible disease, and many of us know some of our veterans who fought in the South Pacific. Many of them came home and suffered with malaria their whole life. If you had a grandpa or someone who was in the South Pacific, it's a terrible disease, and people suffer lifelong with it.
Yeah.
So,
Any other questions?
are we spraying yet, Mike?
Yeah, we are. We started that. We got all of our drivers trained. Had to hire a couple new ones this year, which is always difficult to get them trained and know where they're going and what they're actually doing. And I like for them to know what they're spraying and why they're doing it for, and get them informed. And it's just difficult to hire people nowadays, and we only pay, I think, only 13 something an hour for night drivers, and to get anybody to work for that, it's difficult. And then the hours are long, so, but yeah, we are spraying. But the main thing is we're larviciding. That's the main thing. The adulticiding is one thing, but larviciding and getting those tars out of the community, that's a big one. Anything else?
One of our other helpers we had this summer was Lily Yeagley. She had finished at IU through their SPIA, their environmental health program, and she was with us until June 27th, and then she and Ann Path went off to Spain to work on a self-sustaining farm. So they'll be there for 6 weeks, so it was nice having Lily back.
Thank you, Mike. Appreciate you and your team. On the nursing division with Chelsea Willis.
If Chelsea looks different, she now has her master's in nursing since you last saw her.
There we go. She did look different, yeah.
I always feel weird up here. So part of this report is half mine. I did leave in the first week of March and then came back the middle of May as the director of nursing. So some of the information was gathered from while I was gone. And then I have Katie as well, who's our new lead case manager. So we've done some cleanup, some visits to Head Start for lead testing, building new relationships with daycares, and just trying to grow out and increase our patients.
We've got a back-to-school health fair coming up.
Oh, yes. That is the final part on here. On 8/8, we're going to do a back on track event with MD Wise and Union, the little clinic behind us that they took over. They're going to help out as well. Last time we did it, we had roughly 70 kids come through, roughly 170 vaccines given. So we're hoping for bigger or roughly the same turnout this year.
And it's good that IU School of Medicine Molly Wheat Memorial Clinic is also doing a back-to-school vaccination physical clinic a couple weeks before ours. That clinic also gives the opportunity for families to go on Saturdays and get their children's vaccines throughout the summer, but one day specifically geared towards just children's vaccines.
Are we part of that at all?
We're not.
I know
No.
vaccines are complicated to get.
They have them. In fact, they took over the old Sycamore Nursing Center at Lansbaum, so they have their Helmers, they have all of that, the stuff that they need.
If people come in through your clinic, do they have to be part of that vaccine program? I know Molly Wheat, they do in order to get it, but,
We take everybody, insured, uninsured,
okay.
insured, and that's, that was one of our strategies when we hired an insurance billing clerk. that we implemented in our 2015 immunization grant, where we were in the bottom 10 counties. That was the game changer to get us up and above the state level of children optimally immunized between birth and 3.
I was noticing a real uptick in the hepatitis cases. Do you guys do that? Am I in the
The-
right category?
The hepatitis
B
C?
virus and hepatitis C.
Yes, we work those ones.
So are we testing more people? This is quite a jump than we usually see.
Some of those, the prison is testing a lot more, and those
The
do
prison or the jail?
prison.
Okay, so that comes under us?
They fall under us.
Okay.
They do go into our account, and I've noticed a lot of our cases have been coming from there. They run their own cases, though, so we don't really get to see a whole lot
Yeah,
from
so I
them.
was sort of surprised by that number, but that's where that's coming from.
Could we separate that number out on our report? Like,
Yeah.
work with Scully, see if we could identify which ones are which and separate them out?
Yeah, I can separate them out by address.
Okay, thank you.
Hello. I've never talked to one of these before. This is fancy. I'm Katie Milner. I just figured I'd introduce myself really quick. I've taken over the role as the new lead case manager here in lead poisoning in children 7 and under. I came on board here at the beginning of April. I'm currently managing 42 cases. That number will get even higher due to the change in where case management starts, which increases the caseload. I get new reports weekly, and I enjoy being able to help these children, and I enjoy working here. And feel free to ask any questions.
So they dropped the number of what's considered lead, correct? The blood level of lead, the state dropped the number last year?
Yeah.
that brought
So
more cases in?
now they want us to start at a 5. So they want me to start case management at a 5. So
It used to be
a 10. Is that right? Yeah. So it's a lot, but we're doing it, and it's working out okay. So it's just a lot of caseload. But some of the time when like the blood draw will come back, and sometimes it'll come back under a 5, so then that case can be closed. So it kind of looks like a lot, but then sometimes we can close those. So, but yeah, it's going good, and I'm excited to see where this goes. So it was nice meeting all of you.
So
Thank you.
Is that something then where the health first funding could then enhance, like to the point we were making earlier? If we were to opt in for the health first funding? Because I see it's on the list of core services.
Yeah.
Yeah, I'm getting a nod from Mike. Good enough. Thank you, Mike.
Yeah. So from the,
Jody and I haven't talked about like what she's planning to do, so it's a little difficult for me to answer, but it is an eligible thing to.
Yeah. Okay.
Is the issue still primarily old houses and old paint? Is that what you
Yes.
find?
Mm-hmm. Most of the time, yes.
good. All right, thank
All
you.
right, nice meeting you. Thank you.
Thank you very much. All right, Amanda Bales with Environmental. Oh,
Shelley's gonna give her report.
or Shelley, okay.
I lost it, paper, rock, scissors, so here I am.
Okay.
Okay. My name is Shelley Rubinacci. I've been here for a little over a year now. We've been super busy. Septic has been out there constantly doing their inspections, pool inspections, the food, which is what I do mainly, that I enjoy, and then the lead risk assessment. We were recently out at the county fair. I know it technically doesn't fall into this quarter, but I just wanted to mention it. We were out there at 8:30 in the morning on Saturday in the pouring rain, and we had roughly about 25 temporary permits to issue that day. And that is not counting our yearly mobiles that were out there. So it was fun. We were all in, parkas and getting poured on. It was cool. As it's been mentioned 3 times, we helped with health vector with catch basins and the tire amnesty. Yeah, the tires wasn't my favorite part, I'm not gonna lie about that. Never knew how difficult it was to get water out of a tire. The catch basins were a lot of fun, though. Got to zoom around ISU on a golf cart. It's not a bad situation. We've done a lot of different things. We've been participating in different food trainings. Every third Tuesday of the month through the state, we have a food training that we get on, like a Zoom, and have been doing. Lead case management training, IEHA meetings, and then Emily and I received our certified pool operator certificate. So we went to Seymour for a couple days and had a couple long days of lots of really hard math. The septic inspectors continue to meet with Mark from the state. The septic rule has been revised at the state level, so there's a lot going on with that. Please don't ask me any questions about it, because I'm not super knowledgeable about that area. And we will be working to update the rest of our ordinances. Mandy would also like to develop a fee schedule for all the fees within the health department, so kind of have like its own little separate thing, and just list out all the different fees, because each area kind of has their own fees going on.
So the fee schedule is coming about because of the septic rule being revised. It actually was revised and then it cut back to July 1. They're saying our fees and our ordinance is good. So they went a fee schedule in place, so that we can charge for our septic. I thought, well, why not have a fee schedule for all of our services?
Yeah.
And then when we have to change a fees, we're changing the whole ordinance, we just change the fee schedule. So I'm working on that, and we're able to see on that one. The septic rule, as soon as we figure out state level what's gonna happen there, because we're still talking about four revisions, then we will be gung ho on getting that updated.
Great.
So, okay, any questions?
Have you had many positives from the hotels, hot tubs and so forth? Positive pool, swimming pool samples?
Yes.
And-
We've had several like failed bacterial tests. There's some in particular, like the other problem pools that fail a great deal of it. So we've had quite a few failed tests, especially after this storm. So a lot of pools have problems with their filters and pumps and started failing tests.
Have they worked with you well? Have they worked well with you to correct things? Okay, good.
They're all really, really cooperative. So. And that's something else we're going to be looking at updating is our full ordinance and our tax ordinance. So we're on like environmental getting it overhauled.
You know, the explosion of food trucks, I mean, it's national TV stories. The competition, I mean, it's like crazy.
I think we permitted 42 this last quarter.
Is that right? Yeah. It's a big deal.
There, yeah.
I had a question about the septic things you were filing. Is there any movement to digitize that, or we are still paper filing and?
We keep a hard copy.
Okay.
We do have a system that they go into. That's another thing. We have a rule out book that compares the addresses. So that needs to be digitized. The county is putting in something in place, comparing something soon, that we will be able to eventually put our septic tanks into. That's gonna be a huge.
Yeah.
Gonna be one of
Time, like, let's get the files that they just bring to this board by, for us that don't do septic every day, they help find the permit. We can look it up, and it goes straight to the board, and find it a little easier.
And this particular system will be linked with area planning and with the building inspection. So in real time, we can see what's going on. They can look to see, building inspection can look and see whether this place is on municipal or a septic system. But it just kind of, because the three departments work so closely together, it just makes for a
Yeah, let's tie
better
all this
relationship.
together so we can see where they're at.
Thank you.
Thank you.
Thank you. Good question. Health education, media with Shelby.
Hello there. So busy, busy as always, as we've all covered throughout the different programs. With these different ordinance changes, we've had some update on how we market our services. So there's been an updated over general health department brochure. There's also been one with the clinic. That's going to be updated again once we finally get the credit card readers in and secure. I've been to a handful of different daycares around the county and dispersed over 100 so far. And it is astonishing to see that these daycares don't even know where we're at and the services we provide. Something else that we have updated is the paper that they fill out in the clinic. It asks how they've heard about us. So from managing these different brochures to potential billboards in the future and radio advertisement, we can see what works and where we're getting our clientele from. That also includes an updated septic brochure, food establishment requirement brochure, and all of this is going to go hand in hand with kind of a branding policy, and I'll get to where I've learned about that in a later. It's just so all of our materials that are out there in the public, same color, same font size, all of that, they can easily recognize it as the health department. There was also a posted vaccine policy in the clinic. Nothing changed. It was just the format of it, and also it brought to the attention of Dr. Brucken, and he signed off and approved on it. Last meeting, I brought up the installments for the bathrooms, the little acrylic holders. Those were approved, and they are currently being posted throughout the building. We're about halfway there, so maintenance is getting that done through and through. We've had our first HIV meeting, well, I should say second. Joni has handed this project off to me. Our next one is actually next week. So we were notified by state. We're coming up with some local, temporary, but also fuller out dates to try and combat this. So I can send you guys kind of like a recap of the meeting for next week. I was a part of the Hoosier IRT meeting at Holman Field Air Force Base, so they came in. They did a lot of services provided for free for the community, brought to us by Casey. So they have all of the statistics with that. Dental services, vision screenings, they did a whole bunch of different things, and I know one day they pulled over 452 teeth. A lot of emergency care and preparedness in rural communities, and this was before we ever knew anything about a regional coordinator. So I was already kind of combating, okay, how can we extend our services for these smaller counties? So I've been trying to get in a lot of trainings for our rural communities. And lastly, the NACHO conference, National Association of City and County Health Officials, I just got back from that convention. It was held out in Colorado, and thankfully during that meeting we were delivered some harm reduction kits. So there's 3 different kinds. One is for intravenous drug users, the other is a general wound care, and a smoking one. And I know some of the questions are, why are we getting involved in this? I have had a handful of different entities already reach out to us asking for harm reduction kits. We can't eradicate drug use altogether right off the bat, but we can establish some safe practices for drug users. And this is starting to give them the control. So if we can give them some control over, how they're using, then we can start giving control over what they're using and kind of build on that. So these will be handed out here, but also through Harsha, Hamilton Center, and some other places as well.
People have to walk in.
For here, I don't know how Hamilton Center and Harsha will do that. I have been looking into some different types of kits. I know that there was one that was kind of like a little box that you could bolt into concrete and just restock. The only, and I'll say issue because I don't know another word to use in place of it, is tracking. So I have to fill out a form saying how many I give out. So I can say 25 to Harsha. I guess I could put 25 in that box, but I don't know if one person's taking all 25 or if 25 separate people are coming to use one.
Do the kits contain fentanyl test strips or xylene test strips?
These do not, but I do know we have some. One of the two, either Harsha or Hamilton Center, has them. We have some in our office, but I can get some to also put in place here. And I'd love to emphasize that these are non-syringe harm reduction kits. I know that's kind of a battle I've been fighting within the community.
Do we do anything with Narcan? Do we distribute Narcan at all?
We do not here, but I know Union does. They have the little vending machine type, and I believe the rural center does as well.
There's a couple places.
It's easily accessible now,
Mhm.
whether it's first steps or next step. I mean, when we were first asked to distribute it, we were like the only ones in the game. And it was for first responders, law enforcement, things like that. Now it's so readily available through so many different entities. And we have it here in our building. The officers that work at the front have it on them. And then one of the other things that we're looking at, we're working with the preparedness division at the state and the HIV division on doing a mass testing in the jail for HIV and then education, risk reduction and testing.
Because there's treatment for these diseases.
Mhm.
You know, we can treat HIV now.
Mhm.
It wasn't true 10 years ago.
Yeah. So there's different materials in each different test, and if you guys ever want to like come and explore them, they're in my office. I have 50 of smoking and general wound care and 100 of the intravenous drug users, just because that's how our population identified with HIV testing was through intravenous drug using.
Do we have a website?
We do have a website. It's not monitored by me. I've been a lot on our social media as far as harm reduction. We can put something up there, although our website it's iffy. If you're just a general public looking at our website, I would get lost sometimes. So I could imagine, you know, a general person, but what if someone doesn't have a phone or Wi-Fi?
Yeah, I see a lot of these different entities. I mean, I know you're using social media, and I don't know if we're limiting our social media use in some way. I know we did it a while back, but I really feel like the social media aspect, we'll be able to get a lot of this information out to the community, and then maybe even funnel them to a website, albeit a little bit clunky, but with the resources there for them.
Yeah, so as far as social media, there's only one application that we're not using, that's Facebook. We won't get that back. There's other accounts. I have to contact the account themselves, like LinkedIn, and have them delete the past account because I don't have any record of the email or password that was associated with that account. So that's a little clunky when trying to address that. But yes, I can address them to the website. Also, what's not in here are some information such as our clinic for other services, the health department in total, but also PACE, because PACE does HIV testing, so each kit will have a little card for PACE. But with the analytics of some of our social media, and I brought this up to Joni while I was in Denver, because that was one of the main topics, was analyzing our use with social media. So I would love to get a marketing intern that has nothing to do with public health to come in here, analyze how many clicks we're getting, how long they're on the applications, start doing some geo-mapping, and also it's a win-win for us. We get some of that analytics, but they also get their foot dove into public health. So that's kind of a twofold thing we'll be looking into in the future. I'm going to send an email out to the Dean of Marketing over at ISU.
So why not Facebook? Because it's one of the biggest platforms
It is.
across. I mean, it touches so many different. I feel like we're leaving out a big one.
It is, but there was, would you like me to cover it?
It's a lot of the younger people have moved away from Facebook, and I think there's so many security breaches, and the fact that as a government entity, we can't control the messaging. People can go on and put what they want, and lots of misinformation, and our page was used for so much misinformation during COVID, it got to be a problem with people trying to, you know, they could use their own page, but they chose to use ours. And again, we can't delete their comments.
Yeah.
You can't control what people put on it, and that's the dangerous part. You can say, well, we're the content expert, but then you have all these other, well, look at this study, or they use ferrets. I mean, just all kinds of crazy stuff was on there, Jimmy. It was so crazy.
So other health departments across the state don't use Facebook?
I don't know if they do or they don't.
Some do, some don't. Some use LinkedIn and Twitter. Some use solely Instagram. I can say that our Instagram involvement has grown, surpassing 150% since the beginning of this year. And that's also with general posts, with stories, but also the little, and I don't know what they're called, they stay on your page. It's kind of like a permanent story. So I have a section, kind of like our website almost, where it has an HIV section. It has a legged section that people can click on and click through different types of things in our community.
Okay. All right.
Thank you.
Thanks much, Shelby. Appreciate it. All right, vital statistics. Loretta Little.
Hello, guys. Loretta's not here tonight, but, so our report is in there for you to look at.
Can you pull that down a little bit?
Everything has been really just steady paced, nothing too crazy. I have only had 2 COVID mentions in death since, in April, nothing since. So that's definitely dwindled away, but everything's just going as it should. You guys have any questions?
Did anyone go to the Vital Records Spring Conference?
Loretta and Robin did.
Yes.
She didn't put that in there, in the report though, but yeah, they did attend the conference, in the spring.
Thank you for doing that research.
Yeah, no problem. Okay.
All right, thank you. All right, time for citizens' input. Is there anybody for citizen input? I guess not. All right, anything else from the board?
Is that the right date? October 5th?
It is,
That's a
because
Thursday.
is it a Thursday?
That's,
Okay, it should be a Wednesday.
yeah, but that's kind of odd, it'd be the first Wednesday.
Because the council chamber will not be will be in use after that for early voting. So I think it's better to have the meetings in here than everybody tuna canned into the small commissioners conference room, so.
So you think the
So
fourth?
it should be the first Wednesday of October.
Which is the 4th.
The 4th, thanks, Mark.
Yep.
And then I have the final results from George Washington University Millikan School of Public Health. And it's their COVID-related harassment of public health workers, a qualitative study. They had put the hook out in all the national public health publications. And you had to go through some vetting process. And as it states in here, they finally narrowed it down to 6 people, and I got to be one of them. So I'll send it to you, and you can guess which one is me. It was fascinating to see it compiled, and really even the conclusion of it was kind of emotional for me because it encompassed so much of what we went through, and even down to talking about moral injury and how that has affected so many of us that have taken our jobs so seriously, and then to have people try to damage your reputation through falsehoods. It's very good.
All right, okay, so next meeting, October 4th, 2023, in the council chambers, and I'll entertain a motion to adjourn.
So moved.
Second? All right, all in favor?
Aye.
Aye. Thank you, guys. Appreciate your time.
Thanks, guys.
at the bottom.